Ladies and gentlemen, welcome to Show Me Tech. Today, with Philomena Colatrella, CEO of CSS Insurance, and Michael Dahlweid, CTO of the Insel Group. Thank you for joining me here today.
Thank you.
Thank you.
So I like to start off our show with something that we call the choice. So on the back there, you'll see two images and one question, and you get to choose one image and just tell me why you chose the image that you did. So I want to kick off with, which do you choose? Are you more of the gym type or more of the hiker?
You want to go first?
I'm the hiker.
The hiker, out in nature? Out in nature, hiking in the mountains?
Well, I hike in the mountains. I love the mountains. It's my, the way I do mindfulness. And I love it because I love the mountains and I love to hike.
Uh-huh. And do you get outside or more of a gym?
No, not at all. I would have chosen the mountains because I'm not a gym type at all. But I find it kind of boring.
Yeah.
So hence...
So you appreciate the adventure a little bit more.
I do appreciate the adventure indeed.
Okay. So with that, we'll jump into our next question. And that brings us into which do you prefer? So this question is geared towards that. Skydiving, more of the adventure, or sailing, more of the smooth ride?
Sailing can be quite adventurous.
That is true.
So I'm going for sailing.
Sailing?
I'm going for sailing too. Because you know the direction, but it's mysterious. Even if you know the direction, it can be a mystery.
Where you end up.
Yeah. And so I choose the same.
Mm-hmm.
Cool. And in the last point, who inspires you most? So on the left here, we have Leonardo da Vinci. And on the right, we have Louis Pasteur, the inventor of the vaccine, considered in many cases. So it's both inspirational gentlemen in their own right. But if you had to choose one, which one of them inspires you more?
Leonardo da Vinci.
Yeah.
It's clearly Pasteur because that's closer to where I'm from and what I'm doing.
Yeah.
And I choose Leonardo da Vinci because he's Italian, like I am. And he's really he has multiple skills. And he represents a little bit the new generation. I love it because it's some sort of universal genius.
Mm-hmm. The definition of a Renaissance man.
Yeah.
Right. And now, to give us a brief introduction to digitalization and innovation in healthcare, please welcome Jonathan Isenring, founder of the Digital Festival.
Welcome, everybody, and welcome to The Brief. Technology has always been the driving force behind healthcare advances. The consumer side of digital health has been driven to a substantial degree by the growth of wearables such as Fitbits and the Apple Watch. Additionally, mobile apps play a crucial role and help extend the ways in how data can be analyzed and viewed. Growing demand in the healthcare systems means providers are looking for new ways to save costs. One significant way is to shift the focus from treating diseases to preventing them. Data gathered could potentially prove a treasure trove for scientists trying to improve public health. Digital health helps to deliver more efficient and effective healthcare and aims to improve individuals' health and wellness. It can cover everything from mobile mindfulness apps to nutrition monitoring and from technical assistance robotics to electronic records. Let me show you a few concrete examples. The Berlin-based startup Merantix believes that in a few years, most of the work by radiologists will be done by machine learning algorithms. Based on the analysis of huge data sets, they are developing a software that helps radiologists to diagnose breast cancer more precisely and prevent misdiagnosis. The Swiss-based startup Skivo developed a compact self-balancing wheelchair for disabled people that allows them to climb obstacles like stairs and drive around in an agile fashion. Skivo combines design and technology in one device that gives the user freedom like no other device currently on the market can. The Swiss-based company and ETH spin-off Vertamed offers surgical simulators for medical education. In this way, physicians are able to train different diagnostic procedures in a risk-free environment. Switzerland's second-largest insurance company, CSS, developed a virtual physiotherapist in collaboration with Magic Leap and their mixed reality glasses. With this, they complement the physiotherapist by giving real-time feedback to exercises and motivating the patient. With all these innovations, there are obvious and sensible privacy concerns over how sensitive health data is used. Additionally, data that has been gathered by digital health tools is focused on a small section of the population. The simple reason for this is that digital health is currently not used equally by people of all ages, genders, ethnic or genetic backgrounds. Those that use digital health tools tend to be fitter and wealthier. It is therefore in the hands of us to develop responsible and fully inclusive digital health tools that enables everybody to benefit from these developments. And that's it for the brief.
So to start the chat, I want to jump in with your backgrounds in that sense. What has been the most meaningful career step in your career?
Well, the most important step for me was to become CEO 3 years ago. I just had the opportunity to get into this new world on development of healthcare innovation, and that really I was enthusiastic about the new progress in healthcare innovation. So that was the most important step because I'm part of this development and I'm happy about that.
Mm-hmm. You can really bring the change.
Yeah, absolutely.
Yeah. What about you?
It's kind of 20 plus years back where I've decided to not continue my medical activities on a day-to-day basis, but to switch gears to join companies where I could be serving my Hippocratic oath by doing something totally different. And if folks would have asked, why on earth did you put down your scalpel, which I've been doing for quite a long time, I told them that if I am a trauma surgeon, right, and I've been doing quite a lot of emergency gigs. If I were lucky, I could save a life per week. If I'm doing my job right now, the right way, I could be serving thousands of patients a week.
Greater reach in that sense.
That's definitely a motivation, which sounds a little bit frou-frou, but it is exactly what I've been doing and why I've been doing it.
That brings me to a question I like to ask all our guests, and this is, what are you passionate about? It can be related to work, it can be related to different things, but what are you passionate about? I feel a lot of passion in your previous answer, so I'm very curious to hear what you have to say.
Let me start right away. I mean, I'm kind of, totally impatient. I can't believe actually that we do healthcare the way we are doing healthcare. And I am not sure why I am not able to convey that message far faster as I am able to do it. Mm-hmm. So I'm passionate to get technology helping to improve healthcare in a way that allows us to, create sustainable healthcare.
Well, I'd like to say that, my passion in the context of, in the professional context is that I can be part of this change, of the actual transformation, not only the technological transformation, but also the corporate culture transformation and the link between technique, innovation, and corporate culture. This sort of, this trilogy motivates me to go forward and to be part of this transformation and to make sure that our patients can benefit from the advantages of technology. So just to translate for our patients, which are the advantages of digitalization? It's not something abstract. It's really, it empowers, it enables the situation of the insured people and patients. So that's a trigger for me.
Because you guys do a lot in that. So I remember you have the My Guide, you have the My Step. You do really a lot of things that people can, it's not digitalization as a buzzword, it's really something concrete that people can actually take away.
Yeah, we decided not only to pay the invoices we get from our insured people, we want to do more. We want to be active, we want to be proactive. We want to cooperate with the physicians, and we want to find new models, new alternative models, integrated models where the patient is really on the focus of these healthcare innovations. And so we decided to do more and to give helps, aids to our insured people, such as My Guide, a digital symptom checker. Just the approach is a gamification approach. We hope that people get more aware about how they are, how they feel, and how to deal better with their body, and with their health. So that's we want to go further than only to give, to pay the bills or to heal people together with the physicians. So that's our strategy.
Because that's my question that I want to start off the discussion with in that context is the status quo. Where do we stand today? I mean, a lot of things that we're working on developing, and we're trying to get there. But how advanced are we today? Like, what is the biggest challenge that you guys see in the hospital and on the insurance side in today's world? Like, what is the day-to-day business, without reaching out to where we're going, but really what we see today?
I mean, let me start right away. If we compare what's going on in Switzerland, regardless of the real great quality we deliver in terms of care, it boils down to sustainability. And one of the challenges we have is inclusiveness or siloed approaches. So we still behave as if healthcare happens, which is actually sick care, to be honest, within a whatever Chinese wall kind of ring fence environment. And everything is taken care of within that environment to, awesome quality. But nothing happens, or we don't care even what's going on before and afterwards. And as long as these patient journeys won't exist in a way that we can be taking care of somebody who is kind of trying to prevent, and then being watched by those who are able to give the right guidance and stuff like that, we aren't able to cope with the cost. And as long as that's going to rise, it will become prohibitive for future development.
I totally agree with this diagnostic. I think it's important to promote and to enable or just to encourage the innovations in healthcare system on the one hand, and we all agree that the great challenge will be these changes in healthcare system, the innovations, the population who grows, the population who is getting older, healthier. And we have really these factors, and on the other side you have many diseases on increase, and with it the costs. We have a market which amounts to 82 billion for 2017. That's a huge market. So the costs are the second challenge. It's a great challenge. Second big challenge, and I think we have to handle together with the physicians and with the actors of the healthcare systems this dilemma.
Do you think it requires a system change, on both sides, both the insurance and the hospital, the caregiver side?
I would say so, yeah. I mean, 3 years back, I've been traveling to a extremely rural place in the U.S. called Mercy, which is kind of, somewhere in Madison, really, really rural.
The middle of nowhere.
Middle of nowhere. A brand new building, actually a hospital, 495 physicians sitting there.
495?
495 physicians sitting there. They are treating almost 300,000 patients a year, but no single patient ever sets a foot into that building.
Telemedicine.
Telemedicine. Wow. Because they have to take care of that rural environment.
Absolutely.
You're kind of, I don't know how many square miles, and they could not cope with that without reinventing themselves. And they reinvented themselves as being a telecare provider instead of a classic hospital. And as long as we are kind of in our mindset that everything needs to happen within the four walls, we won't cope.
Philomena, do you see that also in your context, that we need the shift there, like a system shift?
I think it's important to discuss about the system shift. And I see this point. I think we have to try to bridge the two worlds and universes, the physical one, the hospitals. It's important in some way, in some context. It's important to give certain security to our patients, that they can be in hospital, but they also have to switch to a telemedicine model, to online treatments, to digital symptom checkers as a complementary aid to their therapy. So
to bring both together, not one versus the other.
If you want to change the system, I think we have to bring both together.
Yeah. I totally agree. And that requires even a step before, because look at what happened in Denmark. Years back they had 300 odd hospitals. They brought it down to 80, 90, whatever it is.
So they reduced the number of hospitals.
Totally.
Yeah.
But what they did before is hey guys, in whatever rural environment, you guys can trust us that we are going to take care of you. And they introduced tele-services, they introduced home nurses, yada, yada.
Great.
And only after having done that, they were
Great.
tearing down the local hospital and centralizing everything.
So it's kind of, you don't do it all at once, right?
No.
Because the system changed.
You have to create that trust first, that patients do believe you that they are being taken care of.
So I want to talk about treatment in that context. How has technology changed, or is it changing the patient journey? Have you seen that have a big impact? Because I think people have this expectation of how it goes today. What do you do today? You're sick, you go to the doctor, you go to the hospital. How do you see that changing, both from your perspective as an insurance provider and as a treatment giver for somebody that is receiving treatment today?
What I can say is that the awareness about telemedicine, online doctors, online services we just offer is larger than before. Patients, that there is a propensity to use these tools, to use these aids. So that's one point. That's one trend we notice. The other one is that we, for example, have health. A lab with the ETH and University of St. Gallen, and we try to make life of chronic ill people easier. We don't have the main aim to save costs in first step. We want to make easier the life of people who suffer every day from chronic illnesses. So we try to develop applications by which these patients can have some sort of self-therapy and deal better with their illness. And they have also an interface with their physician, so they can interact with the doctor during the therapy. So
and you did
we do
one
that.
with Magic Leap, right? I believe that was a physical therapy approach for home in that sense?
Yeah, it's a physical therapy for home. That's a complementary tool that we are trying out now. It's a pilot. And it's an avatar which allows patients to do their exercises in a very precise manner at home. And I think these trends are just they're going through. I think the awareness of the patients is becoming is improving.
Do you see this as an openness also from the hospital side to take some of the care that you would do on site and kind of bring it home to the patient? Is there an openness there as well?
There's an openness. Sorry, there's an openness for sure. However, a totally different aspect or perspective is are we getting paid for it? Is a question we are having. So hence, even if you could, there's some sort of no, because it's not kind of reimbursed. But that's a different discussion at all. From a technology standpoint, we are there. From a technology standpoint, we are starting to embrace.
So you would say that it is improving the outcome for the patients with the technology.
Absolutely.
So cost aside.
Absolutely.
Right. So it's more about figuring out also how can we get this cost in line in that sense. Yeah. I want to jump to prevention, right? So I think that the best way to deal with the disease is not to have it. I guess that's probably the best case. But where do you see prevention taking a role here and maybe a shift in the system a little bit, maybe from the hospital side and definitely from your side?
I mean, yeah, from a hospital side, hey, we are the ones who are somewhere down the road. And if we are kind of getting involved, it's kind of, 2/3 of that journey are done already. So hence, our ability to reach out and to start preventive measures are somewhat limited unless we are starting to deal with that entire patient journey, which we are just, starting to do some baby steps. We do it in maternity, for sure. We are reaching out quite early. We are kicking off a quite interesting activity when it comes to young girls who would like to see a gynecologist the first time. They are afraid to talk openly about their whatever symptoms and stuff. They wouldn't talk to their parents at all, neither to their
Do you support
GP.
this also together with the hospice? Is it joint collaboration? Is it something that's still in progress?
Well, prevention, generally speaking about that, it's a little bit difficult because the hospital is, the hospital is operating when prevention, the step of the hospital is further than prevention. So we try to cooperate with physicians, with hospitals, but prevention is some sort of I think prevention is better than cure. This saying is I think it's a good saying, and it's right, it's correct. So we try to work on the awareness about prevention, to offering step programs.
Because you also just launched a new tool that includes some checks in there that people can go do or do themselves, like blood pressure for hypertension.
Yeah, the preventive medicine recommendations. We launched it yesterday, and we want to try. Thank you. And we want to try out how people, or how the patients and the insured people are reacting about that.
And do you work together with that? I think some things you have to go to the hospital to do, right? I think a colonoscopy or different things like that. Is there like the openness to also look at it less as treatment, but also prevention from your side?
Yeah, I mean, again, we definitely would like to, and from a technology standpoint, there's no hurdle whatsoever. What we have to figure out is really, the model in which we should be working together.
Yeah. That's what I said when we started our speech or our conversation. I think the model, when you say model, it's easier to work within a product that is inclusive. Yeah. The product that is inclusive, where you have really an integration of the physicians, of the hospitals, of all actors.
A lot of it is data that comes together as well. I mean, I don't know how much you can share or are allowed to share, but I know that in terms of diagnostic ability, right, data would really help a lot by doing some...
I mean, there are official means to share data, and there is a potential,
because you guys just opened up an AI research center.
We did indeed. So we created the, I guess, first in Switzerland, even in German-speaking environment, AI lab when it comes to healthcare data science, if you like, which allows us to go into some sort of unseen, unheard of, abilities to deal with not only imaging-related data like Morantex, but as well as kind of, the clinical data we have got. And if we would be doing something together to predict the course of a specific disease, we would be capable of, just preventing certain elements to happen, maybe later in the disease, but definitely something which we can't do today.
Is that something you guys are open to as well? I guess the data privacy concerns are obviously a little bit of a challenge there, but is that something that you would be open to in order to help research and patients in that regard?
Well, it's not a question only of openness. It's really a question of trust, and you mentioned it before. And I think, data protection is, high priority in our agenda. Data protection is basic. If we want to promote digitalization, we have to guarantee data protection. We are in a strict governed data protection environment. So we have large parts of our business is certified. So
it's a very regulated area.
Yeah, it's very regulated, and I really stress on that point. We have to respect GDPR, we have to respect data protection laws, and we have to see which possibilities we do have to deduct some patterns from data.
Yeah. I mean, that's really important. What we have seen in many instances is that, if you aren't careful enough when it comes to data privacy and data protection, you do harm, because suddenly not only the data are gone, but the trust is gone.
The trust is gone. And trust is very hard to build.
It's
right?
hard
I guess
to build.
It comes together to that.
Yeah.
And data belongs to the patients. It's really important. Data belongs to the patients. And they have to decide what to
happens
do.
with it, right?
However, what we
for both their context
could be doing is a kind of different approach. I'm trying to always.
We have to wrap this up, but I want to say thank you in that regard. So we love gadgets here at Show Me Tech in that regard. So we saw a few Fitbit, different things there, and as you see over here, we have a whole bunch of different gadgets, and you each get to choose one to take home. The only thing you have to do is tell me why you chose what you did. So I want to take a quick look, and just the first intuition.
Yep. I'll take the Lego. And
You'll take the Lego.
Me too.
So sorry.
Wow.
Sorry. No.
But we have no. It's yours. It's yours.
So
it's yours.
I'll tell you why.
We also have a little robot here, which is like a digital Lego.
I'll tell you why.
Yeah.
Please.
Nothing to do with myself, but we are doing a process recreation.
Yeah.
And we are doing it with Lego.
Wow.
So
you're using Lego to kind of represent
that. We have different teams toying around with Lego. They have to produce and to create their own kind of pathway with Lego, and that's why I'm using it.
Okay, thank you.
But you can take it, please.
No.
We have enough Legos. I'll take the robot.
You'll take the robot.
I'll
Okay.
take the robot.
So why do you
I
take
the
Lego?
robot. I take Lego because of the title of this
Creative?
creative Lego brick set.
Yeah.
I love creativity.
Can you hold
I
it
love,
up just so we can see?
I love
Yeah.
I love education.
Yeah.
I really love creativity, and it attracted my attention, and the colors of Lego. I love it.
That's good. Thank you. Philomena, Michael, thank you for joining me
Thank
and
you.
sharing your insights. It was a real pleasure to
Thank
have you
you.
here today. Thank you for watching, and until next time on Show Me Tech.